My name is Bailey Blattel, and I am a member of the ASN program, concurrently enrolled in the BSN program as well at Southwest Baptist University. And my title presentation is called Educating Nurses and the Effect on CODIs. Educating nurses on catheter-associated urinary tract infections, also known as CODIs, is important to me because after I finish nursing school, I plan on working on an acute care floor where there will most likely be lots of indwelling catheters. I want to be informed on how to prevent CODIs. This topic is important to the public because an estimated 560,000 people a year are impacted by CODIs, and 13,000 of those people die as a result. CODIs are important to the healthcare system because it costs the healthcare system an additional $131 million a year. This money could be used in other areas of healthcare, such as research. CODIs are important to the patients because along with pain, discomfort, embarrassment, and possible death caused by infection, it also increases the cost and length of stay for patients. For my statement, my population of interest was acute care hospitalized patients receiving an indwelling catheter. My intervention was nurses receiving more education on CODIs, and my comparison was compared to non-formally educated nurses. The outcome that we were hoping to see was a reduction in the number of CODIs. There is no time for this assignment, but for an example would be a period of 3 months. Altogether, the statement reads, for an acute care hospitalized patients receiving an indwelling catheter, does nurses receiving more formal education on CODIs compared to non-formal educated nurses reduce the number of CODIs? For my 5 research articles, I did 3 different searches using the CINAHL database for all 3. For my first one, I searched using the terms and boolean CODI prevention and reduction and use. This brought me to 131 results. I then used the filters full text selection in the years 2016 to 2019. This brought me to 40 results where I chose the articles by Ferguson, Carr, and Richards. For my second search, I used the terms and boolean "CODI" and "inappropriate." This brought me to 194 results. I then used the selections of full text and the years 2016 to 2019. This brought me to 51 results where I chose the article by Parker. For my last research article on CINAHL, I searched using the terms and boolean "CODI" and "qualitative," and this got me to 96 results. And after applying the full text filter and using the years 2016 to 2019, I got 34 results, and I chose the article by Carter. Rationale of the articles I chose. The first article was implementing a CODI prevention program in an acute care hospital setting. This was a level 4 descriptive study. The study shows the importance of nurses attending additional educational seminars and the effect in acute health care. The article was also wrote within the last 5 years and wrote by a DNP, so I knew it was a very good scholarly article. The second article, CODI Prevention, Streaming Quality Care in a Progressive Care Unit. This was a level 4 descriptive study. This study uses different phases to improve the research of CODI rates, and it was also written in the last 5 years, so it's following in scholarly guidelines. The next article was Avoiding Inappropriate Urinary Catheter Use and Catheter-Associated Urinary Tract Infections, a pre-post control intervention study. This is a level 4 descriptive study using mixed methods. This article finds barriers and finds intervention in the midst of the study to improve the outcome, which was something I really liked. And the article was also wrote in the last 5 years. The next article, decreasing catheter-associated urinary tract infections in the neurological intensive care unit, 1 unit success. This was a level 4 quality improvement. This article shows various facts about the cost of COTIs and a multi-step program to prevent COTIs. The article was also wrote in the last 5 years, and it was written by various educated nurses. And I like that it had all those numerical statistics in it that I could pull to use for this project. The last article, a qualitative study of factors facilitating clinical nurse engagement in emergency department catheter-associated urinary tract infection prevention. This was a level 4 descriptive study. This article uses focus group and an interview method, as well as multiple hospitals in the study, which is something I really like. And it was also wrote in the last 5 years and by doctorate level professionals, so all very educated on this subject. In my findings, the similarities, all of the research articles showed a positive result in the studies. They all accomplished what they set out to see. Um, Educating nurses decreases the number of COTIs on the floor. All but one study provided nurses with education on the aseptic technique of catheter insertion. All but one study used a focus group or a huddle as part of their training methods and education methods. All studies but one used an electric form or a paper form to track the nurse's charting when inserting the catheters, as well as managing the signs and symptoms of patients with indwelling catheters. All studies were level 4 studies, but they used different methods to conduct their research. Inconsistencies that were found within the studies were what floor the hospital used. Some used a med-surg floor, some used the emergency department, those kinds of things. The next inconsistency was how long the study was conducted for. Some, for example, used 3 months, others used a longer period like 22 months. The third inconsistency found in the studies was if the study used just with the one hospital and did multiple units within that hospital, or if they used several different hospitals in their studies. The fourth inconsistency was who participated in the training, whether or not it was just the RNs or the RNs and the CNAs. The fifth inconsistency was how they provided education. Um, all the studies provided a focus group, but some of the studies did some extra stuff and provided printed materials, web-based materials, change in hospital policy, and test as extra education for the nurses. And the last inconsistency was some of the studies had physical observers that observed nurses' technique and observed them when they were providing patients catheter care, while other studies just provided them with education and then just went back and reviewed their charting after that. Gaps found in the studies were hospital policy was inadequate, ambiguous, creating risk for subjective interpretation, inconsistencies in insertion techniques, and poor maintenance practices. Missed providers' orders, lack of provider awareness of the existence of an IUC, and inappropriate indications for catheter placement. The second inconsistency was strategies to reduce the rate of COTIs would not be effective if none of the nursing staff was engaged in the effort. This is supported by other research. Limitations found within the studies was Ferguson's study only occurred on 2 floors, therefore it was not generalizable, and not all the nurses on the floor participated like they had expected and hoped for. The second limitation was non-adherence from float staff and education not used in every unit inside the hospital. The third limitation was not a good representation of all ED nurses and not able to determine what the CAUTI prevention methods had on catheter placement that was done in Carter's study. The fourth limitation was it was limited to only adults, so it decreased the generalizability. The fifth limitation was in Richard's study. It was not generalizable, and staff members' perceptions were not investigated formally. Identification of underlying themes were subjective, and an atheoretical approach was used. For the conclusion, there is enough evidence to support that providing additional education to nurses helps reduce the number of CAUTIs. All of these research articles came to the same conclusion. They saw a decrease in the number of CAUTIs when using different education methods. All evidence was also a higher level of evidence to support these findings. There was a guideline related to the insertion of CAUTIs, but there was not a guideline directly related to educating nurses on catheter practices. So, yes, I believe these studies prove enough evidence to implement a practice change. Even in the middle of one study, researchers found policy needed changing, and then they changed it right then. All studies concluded came to the same results over different time frames, units, different hospitals, and different forms of education. This proves that educating nurses can reduce the number of CAUTIs. Thank you.